Hi, this is Marissa from Atlantic Center for Independent Living. Today we're going to be talking about the differences between Medicare and Medicaid. They are both government-funded health insurance programs that many people with disabilities rely on for our health insurance needs. So we thought it would be important for our consumers to know the key differences between these two very important programs. We're going to start with Medicare, and Medicare is a federally funded program, and it's meant for those over 65 and for people with disabilities. There are 4 different parts to Medicare. The first is Part A, and that covers your hospital care. Now, Part A does not have a premium, but there will be copays and deductibles associated for those types of services. Part B covers your doctor's visits, tests, procedures, anything in that type of category, and does have a monthly premium. Now, Part C is an alternative to traditional Medicare called Medicare Advantage, and it's handled by private insurance companies. Now, it covers everything that Part A and B cover, and has sometimes additional coverage for needs such as vision and dental care. However, it is out of pocket, so that's a factor you need to consider when potentially applying for Medicare Part C. Now there's Part D, which is going to be your prescription medication coverage. There is a monthly premium and deductibles and copays, and you are also required to have this part. Now with Medicare, there are going to be some gaps in coverage, such as Medicare will not cover long-term care, such as in a nursing home. And next we'll move on to Medicaid. Now Medicaid is state and federally funded. It's meant for those with some kind of financial need and that fall into a number of groups. So it can cover pregnant women, it can cover parents that demonstrate some type of financial need, such as, parents that just need coverage for their children, or maybe they have a child with a disability and need extra coverage and have some kind of financial need. And it is also for seniors and people with disabilities. We talked about, the gaps in coverage under Medicare. A lot of people will get Medicaid in addition to help cover those gaps. And also low-income people. Now, the Affordable Care Act provides states with an opportunity to expand their Medicaid programs and help cover more low-income people in those states. And if your state did expand their Medicaid program, you might be eligible for Medicaid, regardless if you have children, regardless if you have a disability, and regardless of your age, as long as you have some kind of financial need. Now, under Medicaid, it does cover long-term care, hence why some people get it to fill in the gaps for Medicare. So, like nursing home care would be covered under Medicaid, and also covers custodial care, which is personal, assistance care that helps you with your daily activities of living. And this can be provided in a facility, such as a nursing home, or you can have it at home with a home health aide or a home nurse. I hope this video was helpful, and if you have any questions, leave them in the comments. All right, thank you.